Is that necessary? Oh, that's the worst thing I've ever felt in my life.
Be low. When I used to say, YouTubers, get a real job.
Yeah.
Here I am.
Here
Gray
you are.
beard. Hammering doctors. What's going on out there, YouTube land? Today we're with a very special guest, Dr. Emeka Ejufo, MD. He's also known as Dr. Blades on all social media platforms.
That's true.
So go check out his website. He's a physiatrist, and obviously he works out a lot. You guys can't tell. Look at these.
The tiny guns.
Somebody call him a veterinarian because these pythons are sick.
And they can go to drblade.com and they'll be a good place to figure out what you need.
So we'll link all those below. He's had a couple dust-ups recently, so he's going to tell us a little bit about what happened to his knees.
That's fair.
His shoulder. And like I said, he's physical medicine rehab, so he does a lot of injections, does some dry needling, works with PTs, OTs, all those kind of guys. So he's pretty familiar with a lot of body work, except for maybe just like the hammer stuff is probably one of the only things you haven't had done.
I think that's going to be a new thing for me, but I'm looking forward to it. It looks interesting.
Yeah,
so I've had a couple injuries in my life. I've torn both patellar tendons. I've torn my left Achilles. I've had a torn meniscus on my lateral side. I've rolled my right ankle and broke it. So I've been through a lot. Oh, and I also fractured my L4 vertebra when I was like in 8th grade playing football. And my dad didn't believe me for like 3 months. I was just in pain. And then we got an x-ray and figured that out. So yeah, I've been through a lot, but I'm still here.
His dad's a doctor.
Yeah, my dad's a doctor.
It means there's someone else to always be faking it, right?
Yeah.
My dad was my football coach. He did that. I broke my leg and he went and threw me on the sidelines. He's like, oh, he's fine. No, tib fib fracture, growth plate, the works. All right, so ready to rock and roll?
Yes, I'm ready.
Cool. So right there.
Yeah.
Go both hands like this for me. Push this one out. Okay, and the side. Anything there? No? Okay, push in.
No.
Thumb up. Anything?
No, but I feel like I'm compensating on my biceps.
Alright, that feels like we're dealt. No problem.
No.
We'll pinch you.
Yeah.
Okay. Back to here. Go all the way up here. And all the way up here.
That just feels limited, and I can kind of see it when I'm like on my back when I'm looking at my back or trying to do like the scapula pull-ups. I can't even do it because like this arm starts bending because it's not rotating.
Because it feels like the scapula won't get out of the way.
Yeah.
He's gonna choke himself out there.
Yeah.
You got pecs that big.
Yeah, it feels tight in here.
And this is a little anterior too. So you don't feel anything there, but when we feel right there, that's our juicy spot. Let's shake one more thing right here. Palm up, and then resist me. So you're working harder here, right?
I'm having to focus.
He's actually strong enough to do it still, where a lot of people you'll see him kind of cave on that one.
Yeah.
But he's definitely activating different muscles there. And you compensate in here too. Turn your head to the right all the way. And the left all the way. Left is easier.
Yeah, it feels smoother.
Okay. All right, good. Look straight down. So tell me a little bit about your fitness. What got you into medicine? You have a master's degree in biomedical science. Is that correct?
Yeah, that's correct. So growing up, I was told I was supposed to be a doctor because my parents are Nigerian, and I was like, I don't want to do that. So I started getting interested in learning about business, and I was really big into fitness. I played sports all my life, and then during that journey, when I was 21, I was playing flag football game, and I jumped. I was a quarterback. It was a high snap. I blame my center.
To this day.
It was a high snap, and I heard a loud pop, and those days my injury journey really began. I tore my Achilles, and I had to be helped off the field.
How old are you?
I was 21 at that time.
Oh.
And I remember calling my dad. I'm like, yeah, my
Is it a real?
foot doesn't really work. And he's like, it's probably an ankle sprain. You're fine.
I'm noticing a pattern here.
Yeah.
You're fine. Rub some dirt on it. You're like, I don't think I'm fine. It's
like, no, I can't move it.
Yeah.
And then eventually, I got that worked out. Had to have surgery on that.
Right.
So that was my first journey. And then kinetic changed the thing, so it kind of just went up the leg. So from tearing my Achilles 4 years later, in intramurals again, playing basketball, first play of the game, tore my patellar tendon on the left side. And I just remember sitting down. I was like, well, here we go again. I guess it's gonna be an interesting journey. And then after that left patellar tendon, I was in biomedical science school at the time, my master's. And I was still on my journey to become a doctor. Didn't really know exactly what specialty. But I remember like dealing with a lot of quad tendon pain after that recovery, and I couldn't play sports like 2 years later. I was like, what's going on? So I just went to some orthos, and they're like, oh, well, you're fine, you know, everything's attached, you have some definition in your quad. And I'm like, well, that's just because I have definition everywhere, but that doesn't mean it doesn't move like it's supposed to.
Like I was born with this condition called scoliosis.
Yeah, you know, it's genetic. From there, I met like sports medicine doctors, and they kind of explained to me like what PRP was. And it wasn't until I did a rotation actually when I was in medical school with a sports medicine doctor that happens to be one of the old partners of my program director. And I did PRP for the first time. It was after they did like ultrasound of my quad, and they're like, oh, you have a bunch of tears in your quad. That's why you're in pain. I'm like, why didn't anyone pick this up the last 2 years?
Yeah.
So I was kind of angry. But they gave me injections. 3 weeks later, for the first time, I was able to lunge without like being in pain for like 2 years.
Wow.
And you know, going from like a freak athlete to like just wanting to walk without pain, it was like a huge thing for me.
Right. So that was a big eye opener for you.
Yeah, and I was like, you know, I would love to have access to this and be able to help people the same way these kind of people helped me.
And also selfishly, because I know I'm going to mess myself up.
Yeah,
I need to have this around, you know.
Yeah, that too. And I was right because, you know, 6 months ago I tore my right patellar tendon, and I was like, I called my knee doctor, who happens to be one of my buddies. He's a pulmonary doctor as well. I'm like, yeah.
Yeah.
I just sent him the images.
Guess what?
He knew what was up. I was like, all right, fine. And then 2 weeks later, I got stem cells put in my knee, and he's been taking good care of me.
Okay.
So shout out to Dr. Pappas and Dr. Ron Torrance out at Regenix in Tampa.
There you go.
I didn't want to become a pediatrician because my dad was a pediatrician. So I was like, there's nothing out there.
That's not for me.
Yeah.
That's actually when I was finishing chiros, because I almost left to go to osteopathic school in the middle of it.
Yeah.
But at the end of the day, PMR was the only thing that I could even see myself really doing. Like I was never really interested in surgery, or, you know, later on I was like, I don't know, anesthesiology might have been okay, and you know, really got into like studying neurology. So like, unfortunately, actual neurologists have to deal with such crazy, complicated stuff that's sort of depressing. And
yeah, it is. Because I have to work with some neurologists. It's
right.
rough. And one thing I really always wanted to work with was like motivated patients. And there's some specialties you don't see that.
Right.
You know, you see people that are
just by nature.
You know, their body's deteriorating. They were never priority. Health was never a super priority for them. But like, and that's not very fulfilling to me. Versus you work with someone that's, you know, an athlete. They're trying to, you know, they're doing everything they can to get back.
All right, bring this arm right here. I'm gonna have you bring it in and out like that. So externally rotate. Come back in all the way
I
up.
remember watching the video you did, and someone was like, "You must have the strongest thumbs in the world."
At least in New Mexico, maybe. I don't know. Dr. Greg here, who runs this office, has pretty strong thumbs. All right, there.
Yeah, right there. A lot of muscle and poor biomechanics.
Swole. So what sports did you play growing up?
I want you to guess. So take football out because I stopped at 8th grade. Yeah, I played soccer most of my life actually. My mom didn't want me to play to begin with, then I break my back, and then I was like, all right, well, I can't do that again.
I broke my back, my neck and my back. Spinal.
And then I had my little Mike Tyson moment, and then after that, I played soccer most of my life, and then after that, when I was in college, I started doing intramurals, and I was just playing flag football again. It's coming like Potato Head.
That's my nickname.
So how'd you get started being a YouTuber?
She made me do it.
Oh, smart. Let's see where the brains are in this environment.
Yeah. No, we just, my Instagram kind of popped first, maybe like 10 years ago.
So you got on it at the beginning.
Yeah, so, you know, I worked with MMA fighters for over a decade, so, which is funny because I didn't even do manipulations for a long time. I just stopped at sure. Yeah. But we had a couple fighters from Europe that would go see osteos over there. And they said, hey, film this clip, put it on Instagram, 600,000-700,000 views right off the bat. And we're like, what's this? So we put the same clips vertical on YouTube, 1.8 million, 3 million, you know. And it was just this, we caught lightning in a bottle in a way where people were like watching this stuff for like ASMR. It's like pimple popping or whatever. Yeah. Except for we also had access to pro athletes and, you know, so it just took
cool
off.
People, like kind of seeing the behind the scenes stuff.
Yeah. So they're seeing like a fighter that they like and like watching them get worked on. And eventually we've kind of turned it into like a podcast as well where people, they're learning about cool people and we ask you guys questions about what got you into your fields. And hey, by the way, if you guys are watching, I think you're supposed to hit the notification bell. I've been told Susan Wojcicki unsubs people. So check. And if you're not going to subscribe or you're already subscribed, unsubscribe from my channel and go subscribe to his channel. I don't know the rules. But I'm supposed to say that. There's a good spot.
There's no better motivation to train your legs than to get in a mankini and step on stage. So it was just a way for me to prove that to myself.
Okay.
And I competed. I was in the muscle division, unfortunately, which meant that I was up against people like 50 pounds heavier than me. So I got last place. So I had the coaching and everything, but
Not the time.
I learned about some of the pharmacology necessary to produce some of these physiques. So I was like, a lot of people discredit everything that you've done whenever you tell them like you're on any enhancers.
Right.
That's just the way social media works, because you got, for the first time in history, you have like 16-year-olds and 60-year-olds all having conversations. So like there's so many people in different levels of their education. And I think that put him in a position where he's like, okay, he wants to promote a message, but he feels like a lot of people are going to discount it because he's on hormone replacement. But like if you look at him before he became the Liver King, and his voice turned into some dark, deep voice.
Primals! So as a physician, how do you feel about eating raw organ meat?
Well, as a physician, I was taught what happens when you eat a lot of raw foods and like all like the parasites and the worms you can get. So it's just like I would have to really do my research to make sure those things are cured and prepared.
But you don't do that.
No, I've had liver, but I cook it.
This physique is not made from raw organ meat.
There's no raw organs in my. Well, there's raw organs inside me, but like I didn't eat them. No, that's not my thing.
Yeah, I agree. That's sushi. You know, I'll have some sushi.
Yeah, sushi. But even still, like some people eat sushi and they get, intestinal tapeworms and stuff. So like,
facts.
Things happen. So it's like I wouldn't want to put myself at risk for doing that. But I'm sure there's a way to prepare it. He has a professional.
So you're not a sushi guy?
No, I love sushi.
Okay.
We have a lot of food here that's like hyper palatable. People don't even have any food awareness, and like nobody back then was living to the age of 90.
No.
So if you want to optimize things, awareness is key.
Correct. So where do you typically fall down as far as like optimal diet as a generality? Obviously, there's a lot of specificity for each individual person. But what's like your?
I would say start with the fundamentals, simple one ingredient foods, making sure that you're getting sufficient.
So real food, less processed.
Yeah, real food. Because I made a whole video on ultra processed food.
Is that on your YouTube channel?
Not yet. It's on my membership course, but I'll put it on YouTube. I'll put snippets up on YouTube. So. Yeah, I talked about how ultra-processed foods, like when they run in studies, they'll see that if people were just left to eating ultra-processed versus like single ingredient foods, they're more likely to overconsume by 500 calories without even feeling hungry, like more satiated. So it's something you can't control. You're automatically eating 500 more calories every day.
Sure.
That could end up being 40 pounds at the end of the year. So like it's not like people that are super obese, sometimes they're like eating more volume, but they are consuming more calories in the form of ultra-processed foods. And one thing that I learned is when we started cooking food, I know Liver King doesn't cook food, but when we started cooking food, our body was able to extract more calories from that single food. So,
and most of the foods we eat today didn't exist 1,000 years ago.
Yeah, we put hormones and everything.
Virtually all the foods we eat, like dairy cow don't exist in nature. We bred them from ox. The modern day chicken doesn't exist in nature. It does now, I guess, especially on islands.
Yeah.
But it's not a natural, animal. These, the types, even the vegetables we have, like most of them are modified bred foods that we created in the last 1,000 years.
Yeah, you look at the fruits and they have way more sugar. Like the bananas, like 10 times the size that it used to be. Processed crap tastes delicious. I love hamburgers. Yeah. I love fries.
Yeah.
I just make everything myself.
So I wanted to play football, but I was always a really skinny, hyperactive kid, running around. And like, you got to get your ribs covered, da-da-da-da-da. So they would take me to go get a double quarter pounder with cheese every single day after school.
Wow.
So while it didn't make me fat necessarily, I think what it did was it normalized that kind of food and diet.
Yeah. And
I've definitely struggled with that my whole life. It's like, let me just swing through the drive-thru here and I'll just try to keep my calories low. But it's the most processed, most chemical crap.
Once you have like any of that, like it just makes you want to eat more of it.
Yeah.
And it's funny because
those companies, they literally have scientists that are formulating the look, the smell, the chemical flavor, to make you want more of it.
Oh goodness.
Nobody knows how to convert Kelvin anymore,
That's just no goes. It's what, 0 to 276?
There it is. I think it's 3 maybe.
No.
Is it 6? Is it 6?
It's 276.
Somebody drop a comment below. Correct one of us. I think he's been in school more recently than me.
I
So
was in math counts. I was in chemistry club. I was in what other club? The chess club. I was a nerd. All right, don't let these muscles fool you.
Yeah.
I grew up with glasses.
Let the arm drop. And I was wearing the Horace Grant goggles in 3rd grade.
Oh, me too.
Yeah, but your 3rd grade was like 10 years ago.
Both 30.
Oh, we're both in our 30s. There's a big difference in that
You
gap.
just got to round up. I got to round down.
Yeah, exactly.
I look better?
I've been rounding up for 10 years.
Oh, still clicks.
How's the blockage?
Less blockage.
Okay.
So what are we doing with this here at Chisel?
We are trying to move the humerus down relatively compared to the scapula to create a little more space.
Nah. Oh, goodness.
Let it drop. So if there's upward or medial impingement, sometimes we can clear a little bit of space underneath the acromion with this.
Okay.
At least temporarily.
How do we make it perfect? Oh, goodness gracious. That last one was personal.
A little bit. That was for 273.
Okay.
Or 6.
I feel like that cleared it up. That last hit, no, that did something.
Yeah, that's way better. Go ahead, and I like that. Straight to jail. Jail.
These conspiracy theorist doctors.
Jail.
Oh,
Straight to jail. You are a conspiracy theorist when you want people to eat right and exercise. And
Yeah, that's not real.
next thing you're gonna want them to sleep like 7 or 8 hours a night.
Yeah.
Drink water.
I'm part of Big Health.
Yeah, I knew it.
The Big Health lobby.
Yeah, you're part of Big Water Lobby.
Yep. It's never fun. I've had this stuff a lot. So what does this do? Is this?
It's pin and stretch, so it's deactivating the
I'm
muscle.
trying to think about which muscle.
Mostly subscap, some lat.
That's right. Makes sense.
Should go a little bit there. There's a little serratus.
Yeah, sorry, just didn't.
Mostly subscap. So when you lose your ankle mobility, it puts more force on the knees.
Mm-hmm.
So when you're creating a lot of force, then they go boom too.
Yep. And the problem is I can still create a lot of force. It's not appropriately.
Yep. And add chains, maybe. That's so VMO tear, right? So change the way I'm pushing off here. Left hamstring tear. Left hamstring tear, right groin tear. Right groin tear, right hamstring tear. Now lean forward, bring that knee past my shoulder. And go back all the way now. And forward. Yeah, I did my first NPC show, I think 2011 maybe?
Okay, we could compete. Do you want to compete again next year?
Nope, I'm
We
out.
can do it together.
I've been out, bro. My last show was in 2013.
What division? Board shorts?
And you know it. You already know it. The no legs division, baby.
No, he didn't say what division for.
He knew. It was the rooster tail that gave it away, wasn't it? I think it was.
Yeah, man, you just look like you're part of the board shorts.
Was it the rooster tail?
Yeah, man.
Switch for you. Those guys. Those freaking guys. Raise this leg as high as you can. Knee straight. Yeah, there we go. Oop. Left side.
No, you want me to do it?
Yeah. Back down. Yeah, we can tear your tendons off doing that.
Yeah, for real. SI joints crap.
Okay, right side again.
I still activate my glutes too early.
What'd you say?
I feel like I was
Okay, right side again.
there.
No.
How am I supposed to get?
I don't know, ask Snoop Dogg. I abstain. I'm straight edge.
Sure. Just naturally high.
Exactly. And right side up again. I get chocolate wasted. Okay, right side again. There you go. Left side. Tender then?
It's gonna be.
Like that?
Yep.
It's gonna be. Gonna be me.
So, explain to the viewers why this increases the hip extension.
Well, we don't know for sure. We think what we're doing is gapping the SI joint and changing a little bit posterior tilt. Okay, left side again. Okay, back down. So instead of just doing a twist manipulation like, D or Chiro, we're trying to get a little more specific with the line of force. Which if we know the angle that the SI typically gets jammed. Like there. Okay, left side again. And it starts to open.
Is there anybody this is contraindicated in?
Yeah.
Like grandma with osteoporosis?
100%.
Okay.
Mets. But as you can tell, most of the force is with my bottom hand.
Mm-hmm.
So the top hand is just punching through the end range. Okay, left side again. There. Okay, that right's moving real good.
Okay.
And this one. Nice to meet you again. Did you know Chiros could do proctology exams in Oregon?
I wasn't aware. I didn't read that in the waiver.
In Florida, yeah. Okay, left side again.
Don't beat your kids.
Make sure to become a doctor. So yeah, your contact point be low. There's your brush. Still with us?
Yep. Still on the planet.
And so those facets feel like they're moving pretty good there.
How do you know? You got the magic hands.
So feel that?
Yeah. That doesn't feel.
That one doesn't feel like it's moving great. Up here feels okay. So I really only feel that spot there. So when I do that over here, because I already cleared this whole side.
Yeah, it's pretty loose, not as tender.
And that's, when you get in those cavitations, that's all it is the facet joint reaching in range. So bring it there. Drop your left shoulder. There it was. Yeah. Right there.
Yep.
Cool. Sit back up.
Still alive. Oh my god. That is very painful.
Woosah.
Is that necessary?
A little bit.
If it's painful, yeah.
Yeah.
It's because of the board shorts comment.
It is. It is.
It's just a guess.
It was a good guess.
I was right.
He was right. He's been right about everything almost. He got my name right on the first shot.
I'm a professional.
Didn't get your name right on the first shot.
Still don't know what it is.
All right, turn your head to the right.
It's cleared up a little bit.
Yeah. What I used to say, YouTubers, get a real job.
Yeah.
Here I am.
Here
Gray
you are.
beard. Hammering doctors.
Sounds like a great profession.
Could be worse. Turn your head to the
I
right.
volunteered for this.
You did. Turn to the right. You didn't even read the pay fee, the fee structure. Keep going to the right. You thought your student loans are bad. Keep going. Keep going. At least you're only paying like 7.1 APR on those bad boys. This is gonna be 26, baby.
Oh, damn.
Keep going. Don't worry, it's compounding. Keep going. Look all the way to the right. Good. Okay. Back to center. Go right again. Almost.
Might be surgery.
Just cut it off. Take this arm and go up and down with it like that. I'm gonna hook you right there. Raise that arm all the way. Raise the roof all the way. Raise it. Raise it. There we go. And again, really lift that shoulder blade up. Good. One more time. Good. Okay. Now look right again.
That looks like it went more.
Yeah, the Rob's these.
You gotta ask me first.
I need a drink.
Yeah, I did.
Remember that informed consent sheet?
I didn't read it.
Lies. Lies.
Did not say you can pinch the front of my neck.
I think it said, soft tissue mobilization. Some of the side effects could be soreness, tenderness.
Why do people hate that so much?
Have you
tender.
done this before?
Yeah, I've had that. I hate it. But
It's
I'm just
so
trying to understand
sensitive.
Yeah.
why.
And it's
we hate it.
vulnerable.
It's vulnerable. That's
Totally.
what it is. It's different than all the others.
Everything in here is like really important.
Yeah.
Is it? I mean, you got vocal cords. It's no big deal. But that's just so sensitive. It's
It's
crazy.
so sensitive.
Oh my god. You should create a device for this.
Yeah, it's like anything in here too feels like
Intrusive.
yeah, like your body knows like somebody coming in here is like I don't know.
Yeah.
Same thing in here. Like I'm in danger.
Yeah, for real. That's aggressive.
Yeah, seems pretty good now. A little bit of the scaling.
Like makes my eyes close.
You're gonna get cervicogenic referral out of there.
Oh, that's great. I have to give myself Botox.
Hey, if you got it, use it. Sound like my Clostridium at least.
Oh, that's the worst thing I've ever felt in my life.
Yeah. Your SCM goes crazy, you get dysdiadochokinesia.
Can't even pronounce it.
Me neither. Just probably made that word up actually.
That is literally the worst possible. It's such a weird sensation.
Yeah, right there we'll refer to your
Eyeball?
Yeah, V1. It'll hijack that trigeminal nucleus. So a lot of people's headaches obviously come from there.
Really? From
Yeah.
this? So should you just massage that and
You
then it
could.
goes away?
You could Botox it. You could nerve block it.
Oof.
Battle of YouTube. Arm wrestling.
I'll beat you. I did you see when I tore the kid's bicep on a cruise ship?
No.
Yeah.
Why? How?
He wanted to arm wrestle me. I'm like, it's probably a bad decision. I haven't lost.
I wouldn't.
He was like, oh man, I'm strong, man. My max lifts are like 1,000 pounds. I'm like, all right, whatever. And we did arm wrestling, and I tore his bicep.
You do tear a lot of things.
Yeah,
You're too much force, bro.
And
Tear your stuff, tear other people's stuff.
yeah, it was bad.
Probably a good thing you're not an osteopath, honestly.
Yeah, that's true.
If you snap. All right, turn your head to the right.
Definitely feels more opened up now.
Yeah, that's pretty good.
More even. So after I've been violated.
You do that yourself too if it feels tight.
I'm not doing that today.
So right hand, you can tilt your head to the left, and then you just pluck that way.
Okay.
If the muscle's elongated, you can't get into it.
And it's just this.
You just pull those little sore spots out. Obviously, you can't press in. Go sleepy sleep.
Yeah, don't do that.
Yeah.
Don't press
We
it.
don't need carotid sinus reflexes.
Some kid did that to me in college once. He's like, oh man, let me show you something.
Do that?
Yeah. And then I just passed out and woke up on the ground. I'm like, what did you just do to
It's the
me?
weirdest feeling, right? You're like coming out of a dream. You're like, what?
It's like you're coming up an elevator.
Yeah.
All right, don't ever do that again.
And you don't have any memories, and then you see people standing over you, and you're like, what just happened?
Yeah.
Yeah. I may or may not have had a UFC champion.
Do that to you?
Yeah. May or may not have had them leg kick me.
Oh, John Jones, I heard he like kicked you in the.
Yeah, you got me pretty good. Got me pretty
You
good.
couldn't take it?
I took it. I mean, I went down. I got up.
Did he hit you in the ribs?
In the ribs? No.
You
No.
could have broke something.
With my GI issues,
Where'd he hit you?
sepsis,
Right in the.
leg kick, baby.
That's fair.
Chopping downstairs. I got one from Holly home here. Michelle Watterson here. Yeah.
And John Jones was the worst.
Yeah. Yeah.
Okay.
6'4".
And he wasn't even trying.
No.
That's crazy.
And then one of my PTs, Dr. Carlos, he took a body shot from Aaron Pico, a left hook, with boxing glove on.
Didn't work well.
Bad these bears.
Did he brace? Or did he just couldn't?
It looked like he let go at the last second. It was, yeah. All right, let's stand up, face this way. Both hands are gonna go right here.
My left hand goes.
Both up top. He's like, I don't trust you anymore, man. You grab my from my throat, elbows down, and tuck your chin.
Oh.
All right.
I haven't had that in a while.
Let's go and sit right there. Pull that elbow back pretty hard. Pull. You pop me.
One was strong in here.
Pop me again. See? He's already ready. Ready for his own crack channel.
Oh, yep.
All right. Stand up, shake that out, see how you go.
What was that?
New stuff.
Yeah, feel pretty good. It's gonna be a work in progress, but it feels like it's loosened up a little bit more.
What do you feel, AC joint?
Yeah. What do you feel like that is?
Huh?
What do you think?
That's super quick on the AC.
Yeah.
Relax that. You get this worked on?
Not enough.
Usually does that?
Yeah, it does that a lot. I feel like it's all stemming from, I don't know, my rhomboids in my scap.
Okay, do that again.
Still clicking, but it's not as.
Does that AC feel any smoother? Like the actual joint?
Yeah, when I'm not doing that as much range, yeah, this feels good. When I go.
Then you feel that super click underneath there?
Yeah. And I just wonder if that's like wearing you down.
Could be bicep tendon too. This rib. That's the table. Neck feel looser?
Yeah.
Good. Thanks for a nap.
Yeah.
Get off the plane. All right, and tell them again where you can find you. Like I said, we linked your YouTube below.
All right, so you can probably the easiest way to find me is just hop on Instagram, Dr. Blade MD, and or go to www.drblade.com.
Where's the blade come from?
So, don't sue me, Wesley Snipes, but what happened was
What happened was?
when I was in medical school, I used to wear like these sporty sunglasses. I had some hair and kind of a little bit of a high top, and people called me Blade from the Blade series, the Vampire.
So that's really the first Marvel movie.
Yeah, that's kind of where it came from. So people kept calling me Dr. Blade, and then it just kind of became its own thing now.
Okay.
Dr. Blade is known more than Dr. Jufo, so it is what it is.
All right, now you know him, Dr. Blade. Go follow him on TikTok, Instagram, YouTube, and particularly go to his website. If you want to look like him, he's got some advice for you.
Yeah, have Nigerian genetics and eat good food.
And eat good food. All right, guys. Like I said, we'll drop them below. Thanks again for coming by.
It's been a pleasure.
Absolutely. We'll see you guys in the next episode.
And you might find what's lying inside. It's just a pack of wolves packing out a lion for lying to mine. It's me and the doc, we got our eyes on the prize. Some try to say they like it, ain't it funny, they stuck in denial. A pharaoh to any peasant stuck in denial. Building pyramids, kids, you ain't fucking with mine. Leaving questions to this world, make you question your mind. Like who is this? I am him, I am. Make her wash the car in the rain, I can. I said it once and never twice, I'm not a rambling man.
Hey yo, I'm back in the zone. It's a fact that I own a rhyme factory. It's back to me exactly alone. It's not a attack of the clones, it's just me cracking your bones. I'm the independent doctor, made it happen alone. And my team is elite, you see the plaques on the wall. Carry the city on my back, I'm not collapsing for y'all. Even in fan fiction, you can't defeat me in your fables. Streaming a cable, dreaming enabled. I'm the guy that defined crime, divine, rhyming with the finest time and refined. Aligning your spine, aligning your mind, trying to rewind time to find mine.